Hi, I'm Maddie. I'm going to be doing a newborn assessment. We're going to start by taking the blood pressure either on the upper arms or on the thighs, and it should be 70 to 50 over 45 to 30 millimeters of mercury. Next, I will take the heart rate, and I'll be doing this for a full minute. The normal range is 110 to 160. Okay. Next, I'll be doing respirations also for a full minute, and that should be 30 to 60 breaths per minute. Alright, next we'll be taking the temperature. It should be 36.5 to 37.2 degrees Celsius. And this should be under the axilla. And then for body measurements for a full term, the length is 48 to 52 centimeters, and that's from the head to the heels. You have to fully extend their legs. And then the weight should range from 2,500 to 4,000 grams. All right, for the skin assessment, the color should be consistent with their ethnic background. Common findings would include acrocyanosis on their hands and feet, and Mongolian spots, which should be marked what their location is, the way they're not confused for bruises later. The texture should be smooth, soft, flexible, and then peeling on their hands and feet is also normal. Another common finding is lanugo, which is the downy hair on them, but there should be bald spots. And then vernix caseinosa is also common from being in utero. And then the milia around their mouth and nose is normal but should disappear in a few weeks. For the skin turgor, it should be elastic and immediate return once you pinch their abdomen, and their pigmentation should be clear. There's also birthmarks that should be noted, or erythema toxicum. All right, for the head, it should be round and symmetric. It should be about a fourth of their body size. It should move left to right and up and down. It should be soft and pliable. Then we will take the head circumference, which is from the occipital lobe around the eyebrows, and that should range from 32 to 37 centimeters. Molding is common in a newborn. And next we will palpate the fontanelles. The anterior is diamond shaped, and it should be flat. Pulsations are normal to feel here. It should be 3 to 4 centimeters long by 2 to 3 centimeters wide. And then the posterior fontanelle should be flat and diamond shaped, and it should be 1 to 2 centimeters. And pulsations back here are also common to find. And then the hair should be smooth and fine. For the face, it should be symmetrical. The eyes and ears should be at the same level as each other. There should be even lips on both sides. They should be able to make grimaces, and their eyebrows and lashes should be present. For their eyes, they should be bright and clear. They should be able to move in all directions. The iris is going to be a deep blue color. The sclera is going to be a blue-white color, and the cornea should be clear. For their eyelids, they should be above the pupils within the iris, and edema is common on the eyelids. Their eyes should be on a parallel plane, so it should be straight across from the inner to outer canthus, and epicanthal folds are common in Asian and some European descent children. Their blink reflex to light should be present, and then their eyes should be wide in dim lit rooms, and their pupils should be even, round, and react to light. And the conjunctiva should be red in each eye. For their nose, it should be symmetrical on both sides, and then it should be patent nares bilaterally, so you can just occlude each side to determine the patency. Their mouth should be symmetrical and even in movement. There should be a rooting reflex present, so this is when you stroke the side of their cheek, and they should be able to turn their mouth towards the finger to suck on it. Epstein pearls are normal finding on the patient's mouth, and then you also need to assess the inside of their mouth, checking their hard and soft palate to make sure that it is intact and that sucking is present. and then also to make sure that their mouth and tongue are pink and moist and that the tongue is free moving. Right, for the ears, the top of the pinna and the outer canthus should be in line right here. The cartilage should be present, so you should be able to bend the ears and they should retract back to the normal position. There should be a Mora reflex when a sudden or loud noise is present, so if I clap my hands, the baby should be able to hear it and have a reflex. The neck should be short, straight, and have creases on the skin folds on the front up here, but the posterior side should not have any loose extra skin. And you can palpate the neck for lymph nodes or swelling. The clavicles also need to be palpated to make sure that they are straight and intact, and the shoulders as well need to be palpated to make sure that they are symmetrical. Alright, for the chest, we're going to measure the circumference, and it should be at the nipple line, and this should be 1 to 2 centimeters less than the head circumference, and this is roughly 32.5 centimeters. So you just go under the arms and across the nipple line. Alright, and then it should be wider than it is long. You can just assess for like a normal shape without any sternal depression or prominence shown. The very bottom part of the sternum could be prominent, and that's normal, and the sternum should be about 8 centimeters in length. Let's measure on here. The chest should expand bilaterally. There should be no intercostal, subcostal, or supraclavicular retractions. And then next we will auscultate for breath sounds, and they should be louder in infants than they are in adults. You just compare each side bilaterally. The chest and axillas should be clear on crying, and the bronchial sounds should be bilaterally even. And the cough reflex should be absent at birth for the first few days. For the breast, there should be 2 flat and symmetrical nipples that should have a diameter of 5 to 10 millimeters, and the distance between the 2 nipples should be about 8 centimeters. And engorged nipples in newborns is a common finding. For the heart, the location should be horizontally with the left border extended to the mid-clavicle, and a regular rate was already determined prior, which is 110 to 160 beats per minute. And there should be no murmurs heard, so we'll just check each of the locations now. The abdomen should be rounded with a cylindrical shape, and there can be some protrusions. It should appear larger in relation to the pelvis. There should be no cyanosis present on the skin. The umbilicus is going to be a blue-white color with 2 arteries and 1 vein and no protrusions. And next we're going to assess the bowel sounds. They should be soft and heard about every 10 to 30 seconds. You should assess this in a clockwise motion. After assessing the bowel sounds, we need to palpate, and we'll do this from light to deep palpation in a clockwise motion. And after a light palpation, we'll do a deep palpation, and in the right costal margin, we'll be able to palpate the liver with deep palpation. And then on the left costal margin, we will find the spleen. And if the baby is relaxed enough, you'll be able to feel the kidneys. After this, we will assess the femoral pulses. They should be palpable, equal to the brachial pulses, and bilateral. And then the inguinal area should have no bulges. For the genital assessment of a female, the labia majoras should cover the minoras and the clitoris. You should be able to spread the labia majoras and gently push. A white discharge or blood-tinged mucus is common, which is known as pseudomenses. And the urinary meatus and vaginal orifice should be visible. For the upper extremities, they should be short and flexed, especially when they're quiet, and you should be able to feel the bones in each of their arms. They should move symmetrically and have a full range of motion in each of the joints, and they should be equal in length. Next, we will open the hands up and count the fingers to make sure that there's 5 on each side, and that the nails should be present on each finger and should reach the tip of their fingers. And then we will assess the palmar grasp reflex in each hand, so they should be able to grab my finger if I place it in their palm. For the lower extremity assessment, the hips and knees should be equal, so you can just bend their legs at their knees. So you hold their legs with your first 2 fingers on the greater trochanter and your thumbs on their inner thighs, and you can check for stability this way, and then also assess to make sure that their knees are even, and if their knees are uneven, it shows hip displacement. For the Barlow's test, this is when you're holding them in that same position and you're going to extend their knees down and out, and then for the Ortolani's, you will push their knees up and in to feel for reduction. Next, you will be assessing to make sure that you can feel the bones in their legs as well, and that range of motion is present. And then for their feet, you need to uncurl their toes and count to make sure that there's 5 on each side. The plantar grasp should be present, so their toes should be able to curl downwards. The Babinski stroke is when you stroke their heel to the pinky toe and then up to the big toe. Their big toe should curl down and the rest of their toes should extend. And you need to assess the foot creases on the bottom for their maturity. The Moro reflex should also be present here, so when they are startled by noise, their legs should move in a symmetrical pattern. And next is the stepping reflex. So if you put them on a surface with their feet on the ground, one should touch the ground and then the other will extend up, and it should alternate to look like they're walking. And then next we'll flip them over to assess their back. Before flipping them onto their back, you can try the stepping reflex by putting one foot on a hard surface, and that foot should extend, and then the other leg should have its knee and foot bent, as shown here. Then we'll go ahead and lay them onto their back, or onto their stomach, and we should assess the symmetry of the scapula to make sure that they are even. And we also need to reassess the back of their head just to make sure there aren't any protrusions or abnormalities. We need to assess and palpate the spine. It should be C-shaped, flat, and straight when they're laying prone. And then once you get to the bottom, there should be a dimple that is closed right here at the base of their spine. For their butt, we need to make sure that their cheeks are symmetrical and that the anus is patent, so you can just stroke next to it, and there should be meconium within the first 24 to 48 hours. Getting farther down, there should be even folds on both sides to show that their hips are not dislocated right here. And then after this, we can go ahead and reassess breath sounds on their back, starting up by the scapula and going across to make sure that they are even as well. And that's all for a newborn assessment.